Now, in company news, Anglo Gold Ashanti's mine is donating its Westvale Hospital, which is situated at Orkney in the Northwest Government. The hospital has a 250-bed capacity and it will be used as a COVID-19 quarantine site. Bafedile Moerane is in Orkney now to perhaps give us some insight into the venue itself and, of course, the handing over of the facility. It does seem as though a whole host of people certainly happy with the decision. Bafedile, what's the insight been? What's the latest sort of on the ground as well?
It's a very good afternoon to you, Simpiwe. We are here in Flagstop at the Dr. Kenneth Kaunda District Municipality in the Northwest. The Hospital Gold Ashanti mine is handing over a hospital whereby they are actually, they have committed to give them about 150 beds to be used here. So to get more clarity and to get more perspective into what exactly is happening, let's talk to the MEC for Health in the Northwest, Madoda Sabata. Thank you so much, MEC, for joining us today. We are here at Anglo Gold Ashanti, where we are expecting to get beds from this hospital. We understand that you have identified several sites that includes government buildings, that includes the hotels and guest house. Can you explain further into that?
The reason we're here today, it's of course the provincial launch of provincial screening we're in Dr. Kenneth Kaunda. But it's accompanied by a program where, in relation to additional hospital beds that each province must secure in case COVID-19 was to overcome the current bed capacity that we have, we have been given by Anglo Gold Ashanti access to a hospital that they are no longer using, which is fully functioned and have everything that we need to operate extra additional COVID-19 beds. The hospital, it's Westvale. It is based in Orkney. And for now, we're going to then go afternoon to then accept the handover by Anglo. The hospital, it's meant to be given to the provincial government. The provincial government will keep it operational and then use it as additional bed capacity that we need in the province in case we were to have many cases that would overcome. But not only in the province. If the country was to need additional beds, now we have received from Anglo Gold Ashanti Westvale Hospital.
At this stage, are you satisfied with the size that you have identified? If there could be a possibility that this disease spread more, and what is it that you are intending to do going forward?
In terms of the program of COVID-19, hospitals, all of them in the province are ready, both private and public. In each hospital public, we have isolation ward. In each hospital of private, we have isolation ward. We also have additional ICU beds available. But what we are looking at, remember, it's two cases. It's cases for hospital and it's people who are tested positive who necessarily are not sick. Those ones, it's either they are self-quarantined home or they are quarantined in a government-determined place, as the president said in this instance. So we are ready for the hospital cases. We are also ready for quarantine, not in a hospital, of people who are necessarily not sick. Remember, this category is the riskier one because it said you are positive but not sick, self-quarantine. What they then do later, they misbehave. This is where the further extension of infection is going to catch us by surprise. If we don't practice social distance and we do not behave at a time when we are told quarantine, we will later see the increase on our cases rapidly because it spread very fast in congested human beings places.
We are seeing you today here. You have launched the mobile screen. How many people have tested so far across the province?
In Dr. Kenneth Kaunda, remember the mobile screening, mass screening, it's followed by mobile testing. We must tell our people to screen in mass. It is that screening that then leads them to mobile testing. And we must tell them screening is critical so that government begins to understand as to the depth of the infection of COVID-19 so that we don't only rely on people who voluntarily go and test them. When you are screened, when you are suspect, you then get referred to testing. What we have been reported to today here is that starting from the day we had started screening in facilities, it's around 39,000 people who have been screened already. But here, the number of the referrals to testing is low. Yet the number of referrals, not surprisingly, it's very high in Bujanala, because when we were in Rustenburg launching the program 2 days ago, referrals were 11. But if you look practically to the cases we have in the province, 15 as of now. Majority of them are still in Rustenburg, which therefore means it's critical from everybody around Rustenburg, which is highly appearing to be the most area that has problems with COVID-19 for now, to get out and screened. But others too in other districts must do the same. But it's critical that people screen. When screened, we will therefore know what is the depth of the infection of COVID-19 in the province.
As you indicated that you identified the site where people will be quarantined, how many people do we have in the identified site?
In the identified site, yesterday in Bujanala were 13 and 2 had passed out. Passed out means you are in quarantine for 14 days. Then you are tested. When you are tested negative in the 14th day, the next day you are released. Those that were still there in quarantine site were 13. And in Dr. Kenneth Kaunda, there was around 5 that was quarantined. In Dr. Ruth, it was 3. In Naga, it was 6. So we don't have many people on quarantine, but what we have is that quarantine is meant to ensure that you are daily monitored and you are daily checked. When you are checked, each time your results would be subjected to the next checkup. But when your checkup, the last one says negative, it therefore means that you must be released from the quarantine and then do self-quarantine additionally 7 days. Remember that 14 days and 21 days, it's 14 days and 7 days extra.
Lastly, MEC, this hospital has not been operating. Is it going to be used only for this time, or what's going to happen going forward?
No, this hospital we are going to check. Our plan as Department of Health is that both Anglo, which is handing over to us now, and Harmony, which is going to be the owner later, must give us the hospital to make it a district hospital. Because Dr. Kenneth Kaunda does not have a district hospital in Klerksdorp. That's why Klerksdorp Tsepong is overcrowded on the basis that people who should be referred naturally to a district hospital do not have a district hospital. They go to a tertiary hospital. For us as health, it's a facility we would not want to lose control of, first, on the basis of the state of the facility, the state of the art. Secondly, on the basis of equipment that you have there. In actual fact, you can be admitted today and there would be no problem. There's everything, including linen. The only thing that is not there, it's oxygen.
Thank you so much, MEC. Simpiwe, this is MEC Madoda Sambata in the province that you heard him contextualizing as what exactly should be expected.
All right, Bafedile, I really appreciate that. Thank you so much for that update. Then myself as Simpiwe will cross to an ad break for now. We'll come back right after this. Do stay tuned.